My topic is molecular characterization of hereditary breast and ovarian cancer patients in the southeast of Brazil. Why is it important? The importance of molecular characterization of hereditary breast and ovarian cancer patients from a public precision medicine service in Brazil lies in its ability to enable precision medicine strategies for improved patient and family care. It enables precision medicine, identifies unique regional mutations, provides basis for risk prevention strategies, increases knowledge of genetic landscape, reveals mutations in non-BRCA genes. Molecular findings. One-third of the 210 patients in the study carried a pathogenic or likely pathogenic mutation. BRCA2 mutations were more common than BRCA1 mutations, which differs from other reports in Brazil. This mutation, C.4829_4830DEL, was the most frequent, appearing in 8.57% of positive cases, and is less common in other Brazilian cohorts. About 14.3% of positive patients had mutations in non-BRCA genes associated with hereditary cancer syndromes. Many patients had variants of uncertain significance, most frequently identified in the ATM gene. Identifying these mutations allows for the implementation of precision medicine strategies to improve patient and family outcomes. Major terms. Hereditary breast and ovarian cancer is the syndrome that increases a patient's risk for certain cancers. Pathogenic or likely pathogenic variants are genetic mutations that are very likely to cause cancer. Variant of uncertain significance is a genetic change whose effect on cancer risk is currently unknown. Next generation sequencing is a high throughput technology for sequencing DNA. Sanger sequencing is a method for sequencing DNA, often used to confirm results from NGS or for specific gene analysis. American College of Medical Genetics and Genomics are guidelines used to classify genetic variants. Precision medicine is an approach to healthcare that uses individual characteristics, including genetic information, to guide medical decisions. New techniques. NGS panels, the primary diagnostic tool which allows for the analysis of multiple genes. Sanger sequencing, used in conjunction with NGS to validate findings and analyze specific genes. Bioinformatic pipelines. Software pipelines are used to analyze the massive amount of data produced by NGS, including identifying SNVs, insertions, deletions, and large genomic rearrangements. Automated variant classification. Bioinformatic tools and established guidelines, such as the ACMG guidelines, are used to classify variants accurately and efficiently. How was the study set up? The service was established through a collaboration between different organizations: Hospital Oncology Unit, Molecular Biology Laboratory, ACOM, which is a Cancer Support Association. The program is based on a developed protocol to define follow-up strategies. A highly specialized team was assembled, including genetic counselors and psychologists, to provide comprehensive support. The protocol includes the use of advanced techniques for molecular diagnosis, such as NGS panels. Patients are referred for genetic counseling and testing based on clinical criteria for HBOC. Hypothesis/question. What is the frequency and types of genetic mutations in hereditary breast and ovarian cancer genes within a specific Brazilian population? And does using a comprehensive panel improve detection rates compared to standard testing? Yes, using a comprehensive panel can significantly improve detection rates compared to standard testing, often by 2 to 3 times, as it screens for a wider range of potential conditions or genetic variants. The purpose of the study is to characterize the genetic landscape of HBOC in a public healthcare setting to inform and improve care management and potentially targeting therapies for these patients and their families. Key goals are to identify the proportion of patients with pathogenic or likely pathogenic variants, compare the results from a multi-gene panel to traditional screening methods to demonstrate the value of a broader approach, understand the clinical impact of identifying variants in genes beyond breast cancer 1 gene and breast cancer 2 gene. How was the study discovered? The study was conducted within a hereditary cancer predisposition assessment and family monitoring program, a public initiative that provided care to patients at risk for hereditary cancer syndromes. Patients were enrolled in the program and underwent genetic counseling, which led to their selection for genetic testing. Detailed clinical data and family history were collected from the patients to identify individuals who met the criteria for genetic testing. How was the study tested? Blood samples were collected from patients and stored in tubes with EDTA to preserve the DNA. A custom NGS multi-gene panel was designed to screen a list of genes associated with hereditary cancer, including BRCA1 and 2, ATM, CHEK2, TP53, and others. For comparison, Sanger sequencing was also used in the analysis. After sequencing, bioinformatic tools like FastQC and MultiQC were used to evaluate data quality and prepare reads for analysis. The identified variants were classified for their biological significance, and statistical analyses were used to compare clinical characteristics between patients with pathogenic and benign variants. Limitations and controversies. A major limitation is that most studies fail to capture the full diversity of the Brazilian population. A significant number of variants of uncertain significance were identified, primarily in the ATM gene. BRCA1 versus BRCA2. Contrary to most reports from Brazil, this study found that BRCA2 mutations were more prevalent than BRCA1 mutations. The study also identified a significant number of mutations in genes other than BRCA1 or 2, which has led to the controversial debate on whether multi-gene panel testing is superior to traditional BRCA testing for hereditary cancer. How does this new finding affect our science knowledge? By identifying population-specific mutations, improving risk prediction and management for Brazilian patients, and establishing a basis for developing tailored precision medicine strategies. This research expands the global understanding of genetic variation in cancer predisposition genes beyond a purely Caucasian focus, reveals novel variants unique to the Brazilian population, and helps inform public health policies for cancer screening and treatment. Are the conclusions agreeable? Yes, the conclusions of studies on the molecular characterization of hereditary breast and ovarian cancer in Brazil are considered agreeable and align with the broader scientific understanding of hereditary cancer genetics. They consistently show that multi-gene panel testing is beneficial for identifying not only BRCA1 and 2 mutations, but also variants in other genes which can impact clinical management, even among patients who don't even meet traditional criteria for testing. And last but not least, here I have a hereditary breast and ovarian cancer and a pedigree chart. You have the male, female, affected individual breast cancer, affected individual ovarian cancer, parents, and one child. Then you have the one with twins at the bottom.